Thank you, Chairman Schuler and Ranking Member Fortenberry, for allowing me to share my thoughts on CMS competitive bidding process for durable medical equipment. My name is Dr. Jon Einfalt, and I am a pharmacist and co-owner of Tom's Rexall Drug, a small independent rural pharmacy in West Point, Nebraska. I'm a third-generation pharmacist, and all that experience is in rural Nebraska. Tom's Rexall Drug provides the West Point area with a wide range of pharmacy services. We have 10 employees. The building our store is located in has been an independent pharmacy for over 100 years. We have a high concentration of elderly patients, and it's higher than than other parts of Nebraska. There are approximately 23,000 independent pharmacies located across the country. Many are located in rural areas and represent the only health care available in their community. Currently, Nebraska has 19 of 93 counties without a pharmacy. In the day-to-day care of my patients, I sell durable medical equipment. For years, my patients have depended on me to provide these products and the education necessary to use them properly and effectively. Even before the implementation of competitive bidding, CMS controlled the reimbursement for these items. In fact, the reimbursement for diabetic testing supplies has not changed for many years. In addition, CMS has greatly curtailed the ability of independent pharmacists to provide some of these supplies to patients by setting reimbursement rates well below the acquisition costs of the supplies. Competitive bidding was introduced by CMS as a tool to control costs. I believe the rules and regulations CMS has implemented with this program will eventually have the exact opposite effect. Competitive bidding and accreditation will eliminate rural independent pharmacies and other small suppliers from the program. Rural jobs will be lost. Patient access to health care will be limited. Access is not just a rural problem. Patients will stop using their durable medical equipment. Hospital long-term care visits will increase, and the small savings garnered in the first few years of the competitive bidding program will quickly be lost due to increased utilization of these higher-cost health care facilities. I can think of several instances like this involving my patients just in the last year. Let's look at blood glucose testing strips just because they're such an important part of treating my patients, the diabetics. Although exempt for bidding right now in the competitive bidding process, they will fall under the accreditation standard that starts September 30th, 2009. Blood glucose testing is a relatively simple process, and modern equipment is fairly user-friendly. However, seldom does a week go by that we are not helping a patient deal with a blood glucose testing issue. All these contacts require face-to-face interaction and hands-on equipment. I cannot remember the last time I was able to resolve one of these issues over the telephone. Some of these patients receive their supplies through the mail, so obviously the mail order supplier was unable to resolve the issue. Pharmacists routinely provide this type of valuable consultation, often at little or no cost to the patient. That will be difficult when we are no longer around. The costs in time and money to implement competitive bidding and accreditation are prohibitive for small independent pharmacies. Current estimates to comply and participate are estimated to be $8,000 to $20,000 and 200+ hours over a 6-month period of time. Most rural independent pharmacies are single-owner operations. I don't know how they are going to find time to prepare for and implement accreditation. With the cost to participate exceeding the profits from DME sales, you can understand that I will not be seeking accreditation or selling any durable medical equipment. There is, however, a more ominous and perhaps catastrophic problem looming here. CMS requires accreditation. If CMS requires accreditation to participate in Medicare Part B, then the next contract I have to sign with the pharmaceutical benefit managers to fill prescriptions will require accreditation. 93% of the prescriptions I fill are governed by a pharmacy benefit manager contract. Say goodbye to Tom's Rexall Drug. Pharmacies in Nebraska are licensed and inspected by the state of Nebraska on an annual basis. Pharmacists are also licensed by the state. Both are governed by a comprehensive set of rules and regulations overseen by the Nebraska Department of Health and the Nebraska Board of Pharmacy. I do not need federal accreditation to practice pharmacy or sell durable medical equipment. I could negotiate that section out of a future contract, but without Congress acting to give negotiating capabilities to small pharmacies by passing legislation like H.R. 971, my ability to negotiate fair contracts with giant PBMs is non-existent. So where does this leave the patient, your constituents? A misguided plan to produce some short-term savings in DME costs has suddenly changed into a plan that has decimated the access to quality health care for rural Americans and increased the overall health care costs for the government. A mailbox is not a pharmacy. If a patient needs an antibiotic, pain medication, insulin, asthma medication, or even a blood glucose testing strip, they can't wait 3 to 10 days to get it in the mail. That means a long drive or doing without. That certainly does not provide an improved quality of life, and in some cases it will mean something much worse. Independent pharmacies are under the gun and need the help of Congress to fix this mess with competitive bidding for durable medical equipment. The results of the first round of competitive bidding are due to be implemented July 1st, 2008. The drop-dead date for accreditation is September 30th, 2009. Early statistics from the first round of competitive bidding show the scenario I've outlined is already underway. There is little or no cost to the government to fix these problems. The government already controls the cost of durable medical equipment. Thanks for inviting me to participate in your discussions.